Welcome back to This Week in Weed. Let's take a look at our headlines.
Cannabis inhalation mitigates spasticity and pain in patients with treatment-resistant multiple sclerosis, according to clinical trial data published online this week in the Journal of the Canadian Medical Association. Investigators at the University of California, San Diego assessed the use of inhaled cannabis versus placebo in 30 patients with MS who were unresponsive to conventional treatments. Authors reported that cannabis administration resulted in a decrease in subject spasticity as measured on the modified Ashworth scale and reduced patients' pain scores on a visual analog scale. Smoked cannabis was superior to placebo in symptom and pain reduction in patients with treatment-resistant spasticity, authors concluded. Investigators cautioned that cannabis inhalation was also negatively associated with short-term acute cognitive effects. However, they noted that the clinical significance of this result is uncertain, because patients were still within the normal range for their ages and levels of education. Overall, researchers described cannabis therapy as generally well tolerated. The trial is one of several recently published studies funded by the California Center for Medicinal Cannabis Research, demonstrating the short-term safety and efficacy of cannabis in the treatment of a variety of hard-to-treat disease conditions. 74% of Americans believe that the federal government should cease interfering in states that have legalized the limited use of marijuana as a medicine, according to a nationwide Mason-Dixon poll of 1,000 likely voters. According to the poll, 74% of respondents, including 67% of self-identified Republicans, believe that the Obama administration should respect the medical marijuana laws in those states that have legalized its use, cultivation, and distribution. Only 15% of those polled said they supported the federal government's ongoing use of federal resources to arrest and prosecute individuals who are acting in compliance with the medical cannabis laws of their state. In recent months, the Obama administration has taken various actions to interfere with the enactment of statewide medical marijuana laws. These efforts have included threatening state employees with federal prosecution and targeting the landlords of state-licensed cannabis dispensaries. The actions contradict a pledge Obama made in March 2008 as a presidential candidate, when he promised to cease using Justice Department resources to try and circumvent state laws regarding medical cannabis. The survey of 1,000 likely voters was conducted between May 10th and May 14th by Mason-Dixon Polling and Research.
That's it for This Week in Weed. Be sure to check back every Thursday for the latest stories in marijuana law reform.